New research shows more people are not having kids, and many of those people are millennials who say they wish they'd planned to have them sooner. As we discuss women's fertility, we want to talk about the benefits of freezing eggs. So joining me in studio to discuss the benefits is the Director of Patient Education at Aspire Houston Fertility Institute, Dr. Jason Yeh. Thanks so much for coming in.
Thank you for having me.
Yeah, so I feel like over the last 5 years at least, we've heard about this, like, younger people choosing not to have kids. I'm not sure if they think if they're putting it off or they just decided they don't want them at all. But talk to us a little bit about freezing eggs and why that might be something they might want to consider.
Absolutely. So there are definitely global and national trends now, basically, where a lot of couples and individuals are choosing to have fewer children, and there's a lot of reasons for that. I think as time goes on, time affects men and women very differently. And so because the female eggs are basically in the body and they're aging through time, the probabilities of pregnancy do go down. So freezing eggs is a great way for individuals basically to protect their future chances of fertility before that probability starts to change over time.
Yeah, and it's interesting for people, not to make assumptions, but if they're thinking they don't want kids or they're not thinking about that, are they thinking about, well, options I can take that should I change my mind later on down the road or just want to postpone that?
Absolutely. I think, I like to use analogies when I practice, but we all just finished watching the Olympics. And so when we think about the egg, the human eggs are actually all inside the human body at birth. And so women basically have something like 1 to 2 million eggs when they're born. And by the time that girl turns 10, we're probably down to maybe 500,000. So we're racing time, basically. Yeah. And it's not just a quantity change, it's a quality change as well. And so, the analogy I use most often in the clinic would be, those very important grocery runs that we do. We've got some very important items and then things that are shelf stable. And then the things that are most important, maybe we have to use them quickly. Or in our case, maybe we decide to have a thoughtful conversation about moving them to the freezer.
Yeah, so let's talk about that process. Yeah. So say somebody sees this and is like, oh, I've never really thought about, what does the process entail?
Yeah, so the way the woman's monthly cycle works out is where something like 500 to 1,000 eggs all line up at a starting line, and then they compete. And there are hormonal signals each month that push one winner across the finish line, and that is the ovulated egg. With egg freezing, we use basically hormonal medications that are derived from the human body, and we encourage more of those eggs to cross the finish line. So the way we do that is with injectable medications. They're very easy, they're very common these days, and then we do ultrasounds just to watch how the eggs are going, and then after about 2 weeks we have a non-invasive procedure. No cuts on the belly, nothing like that, but it's about 5 minutes, and then when those eggs come out that same day, we should know how many eggs we have frozen.
And then they're freezing them, storing them, holding them. The whole process can be expensive, or is it more expensive to figure out on the back end whenever you want to have a child, or is it the freezing part of it?
Absolutely. This is a work in progress, I think, for our industry. Historically, it has been very expensive, anywhere from maybe even $10,000 to $15,000 for a round of egg freezing. But fortunately, I think a lot of employers, especially in these large industries, are starting to recognize that this is such an important topic for our sort of female employees and workers. And so basically, these benefits are trickling down now to corporate levels, and so now we've got lots and lots of patients with great coverage for this.
Oh, that's amazing. Yeah. How long do they last? So say somebody in their early to mid-20s makes the decision. At what point do they need to use them or lose them?
Absolutely. So interestingly, freezing the human egg was sort of the last piece of the puzzle for our field. It hasn't been around since basically released to public until maybe around 2012.
Really?
So it's a relatively new technology, but based on the technology, we envision that these eggs are probably good indefinitely. So 10, 20, 30 years, at some point, obviously, I think that individual would probably age out of maybe even needing those eggs, but certainly I think 20 or 30 years would be an easy time horizon for these eggs.
Yeah, very interesting information. We want to make sure that people can find you if they've got more questions. We'll post this interview online with a link to your Fertility Institute in case people want to find you with other questions. Dr. Jason Yeh, thank you so much for coming in.
Thank you so much for having me.